We are in the last lap of the marathon. Now these are the abdomen is how it is divided by the hypochondrium, this is the epigastrium, this is the hypochondrium, this is the transpyloric plane, the lumbar, umbilical, lumbar region, iliac, hypogastric, iliac, transtubercular plane. Now, orifices. Now, you see the total orientation and the placement of the organs of the abdomen. This is the liver, this is the stomach, this is the transverse colon, this is the ascending colon, this is the ileum, and this is the descending colon, this is the iliac, pelvic colon, the iliac colon and pelvic colon, rectum and anal canal. Muscles of the anterior abdominal wall. Now, this is the picture taken from Gray. You can see the pectoralis major muscle here. The serratus anterior muscles. This. The latissimus dorsi. This is the external oblique, externus oblique, external oblique. This is the crest of the ilium. And the inguinal ligament is here, and this is the pubis. Now you can see the linea semilunaris, and these are the rectus abdominal muscle. This is the rectus. Now linea alba is here. It is from this portion, and you can see the muscle being inserted into the iliac crest. Now, this is the costal cartilage, intercostal is externa, intercostal is interna, and these are the now 9th, 10th, 11th, 12th lumbodorsal fascia, obliquus internus. This is the obliquus internus, this is the crest of the ilium. See, inguinal aponeurotic flex. And this is the cremasteric, and this is the pubis. This is the linea alba. Now you can see another view. This is all from Gray's anatomy. Now these are tendinous intersections here, and tendinous intersection. Now if the anterior rectus sheath muscles are long, then it will be won't get it when you like if you see Bruce Lee's muscles. Now you can see that it is the muscles that in the inserted in the tendons. Okay. Now this is the sheath of the rectus. This is the linea alba. This is rectus abdominis muscle. Now you can see the total picture. Inguinal ligament. Now, this is the pelvis. It's similar, this is a picture taken from Gray's. Now, you can see the lesser pelvis, the brim, the greater pelvis, the pubic arch. This is an articulated pelvis. Now, you can see how the muscles and the ligaments are attached to the pelvis. Now you can see the symphysis pubis. Symphysis pubis is here. This is the pubis. And pubic tubercle is here. Lacunar ligament is here. Obturator canal is here. Obturator canal. This is the obturator membrane. And obturator muscles are there. Now, this is the inferior pubic arch. This is the inferior pubic arch. This is the transastibular ligament. This is the transastibular ligament. This is the acetubulum of the hip bone. Now, this is the ligament of Cooper. This is the lacunar ligament, pubic tubercle, inguinal ligament, anterior superior iliac spine. The beautiful picture depicting the features in the inguinal region and the ligaments. Attachment on inguinal ligament. Now you can see now this is pubic cord, this is internal oblique muscles. You can see in your dissected bodies transverse muscles, internal oblique muscles. This is the linea alba. Now inguinal ligament here, anterior superior iliac spine to the pubic tubercle. This is lacunar ligament, shaped like a moon, half moon. And this is the pubic tubercle here. The pectinate ligament, the pectinate line is here. Now the pectineal ligament. Now pectineal line, iliopectineal line. Now this is conjoint tendon. Now the inguinal canal. Length, boundaries, anterior wall, posterior wall, roof, floor. Contents in males and females. Now the length, boundaries, anterior wall, posterior wall, roof, floor, contents, males and females. Now you can see the oblique, external oblique muscles, the femoral sheath, the femoral artery, the lymphatic vessels, femoral vein, ilioinguinal nerve, pubic tubercle, spermatic cord. Now, when you dissect or the inguinal canal is exposed, you have to, a label is there on iliohypogastric nerve or ilioinguinal nerve, cremasteric muscles, femoral vein. Now, iliohypogastric nerve, ilioinguinal nerve, cremasteric muscles, the femoral sheath, the external oblique muscles. Now you can see the transverse muscles is there, inferior epigastric artery, deep inguinal ring, and fascia transversalis. Fascia transversalis is the conjoint tendon. The fascia transversalis. This is the pubic tubercle, the femoral sheath, the symphysis pubis, palmatic cord. Now you can see again, this is the picture, femoral sheath, femoral artery, external oblique muscle, linea alba, palmatic cord. Again, you can see the inferior epigastric artery, transversus muscle, and your fascia transversalis. This is the deep ring, this is superficial ring. Similar pictures here. Now, inferior epigastric artery you have to take care of during surgery because over there in open inguinal hernioplasty, where a mesh is being incorporated on the pubic tubercle, and over there below this it goes, you put the mesh. It's a proline mesh. Now you can see the testes in the scrotal sac. Now it comes through the opening in the external opening. In the inguinal canal it traverses and then goes in the descent of testes, then it can be arrested in any of these pathways. And accordingly, it is named. Now, this is the fatty layer, superficial fascia, fascia of Campa, fascia of Campa. Now, membrane, now it might be a MCQ question or just a short note, 2 marks. Membranous layer of the fascia and skin of scrotum, dartos muscle, external spermatic fascia, cremasteric fascia, internal spermatic fascia, tunica vaginalis testis. Now this is the conjoint tendon. You can see the similar picture here, the vast difference. The external spermatic fascia, cremasteric fascia, internal spermatic fascia. Hernia. A hernia is an abnormal weakness or hole in an anatomical structure which allows something inside to protrude through. This is the definition. A hernia is an abnormal weakness or hole in an anatomical structure which allows something inside to protrude through. It is commonly used to describe a weakness in the abdominal wall. Hernia with the protrusion. Components. Components. The sac, mouth, body, neck and fundus. The covering and the contents. Types of inguinal hernia. Direct, indirect. Through the Hasselbeck's triangle. Types of inguinal hernia. Direct, indirect. Through Hasselbeck's triangle. Clinical features, clinical examinations. Complications. Now the similar picture, this is a picture from Gray's femoral and inguinal hernia. See, here is the femoral. This is the femoral hernia. And this is the inguinal hernia. Femoral hernia is uncommon. Femoral hernia is uncommon. At least in my this 42 years of practice, I have not encountered femoral hernia till date. So, but in those days where when you used to, the mesh was not a thing, I modified, there are 11 to 12 types of hernia operations. I modified one operation and Banizzi's inguinal hernioplasty. I think the method of suturing was different. When you actually have to strengthen the posterior wall, you have to strengthen the posterior wall. What I did is that after removing the sac actually is a protrusion from the deep ring like this. It's having a fundus and the body like this. It is adherent to the somatic cord. So you dissect out and you separate the hernial sac from the cord. As a result, this is the, it's cut off, and see, this is cut off. The sac is cut off. Now, usually what happens, suture, Prolin suture, or here it's been darning like this. This was a common practice in, when the non-abdominal sutures came in, Prolin, all this. Now, what I did is that I did it in a figure of 8. I did it in a figure of 8 like this. Now these muscles are to suture like this, and then you take it like this, and tight it. Interrupted figure of 8. Interrupted figure of 8. This was my modification. But nowadays, mesh inguinal hernioplasty, open mesh inguinal hernioplasty. This is the inguinal ligament. This is the pubic tubercle. Now, this is the muscles are there. The sac is dissected out. This is the deep ring, comatic cord. Now, what we are doing presently is a mesh of this size, 11 centimeters by 4 centimeters or 5 centimeters. It's a mesh like this. It's a mesh. Now, what we do, we cut this portion, and we, in the pubic tubercle, we make a suture and tie it, and then this is placed under the comatic cord, and over here it is sutured in the external oblique and the transversus muscles, and it goes like interrupted. Then another flap like this, cut off the thing, and you take a and put a bury it in the under the external oblique aponeurosis, and you tie one or two sutures like this. This gives you the picture of open mesh inguinal hernioplasty. Now, rectus sheath. See, this is now this is the defined process at the sternum. This is the costochondral junction, and this is the rectus abdominis muscles. This is the tendinous insertion. The anterior wall, posterior wall, medial margin, lateral margin contents. See, the rectus muscle is here. This is the linea alba, the extraperitoneal fat. This is the peritoneum. And this is the skin, the external oblique, internal oblique, transversus. They split and they cover the rectus muscles. This is the fascia transversalis. Now again, you might have a question, describe the rectus sheath, and so you have to draw this diagram. You just see your own rectus muscle, feel it, and you can see, or anyone who's doing a gym in your friends, you tell them to open the body and you see. And now the rectus muscle, the superficial fascia, pectoralis major muscle, skin, defined process, aponeurosis of the external oblique. Now again linea alba is here. This is the from the see the external oblique, internal oblique, and transversus. They are all coming from the posterior aspect and coming into the midline. and see how they split. External fat, extraperitoneal fat peritoneum. This is the fascia transversalis, the external oblique, internal oblique transversus. You draw this sketch when you are revising or when you are in your exam. You please see this. Now you can see the vascular supply, the nerve supply. These are the iliohypogastric nerve, L1, ilioinguinal nerve, T12 nerve, T11 nerve, T10, T9, T8, T7. Now the superior epigastric artery, inferior epigastric artery, position of deep inguinal ring, deep circumflex iliac artery, lumbar arteries, lateral margin of the rectus sheath, and intercostal arteries. Now this is the picture when the skin is removed, and you are seeing that iliohypogastric nerve, ilioinguinal nerve, position of deep ring, inferior epigastric artery, deep circumflex iliac artery, lumbar arteries, intercostal arteries, the lateral margin of the rectus sheath. This is the inferior epigastric artery. This is the superior epigastric artery.